Hi, I'm Linda from English Learning Mind Map. Today, we will learn about abortion. Abortion. To regulate access and provoke debate, abortion remains a central issue in many societies. At its core, this is about who can access care and why people strongly disagree on it. Legislation. Much of this debate is shaped through legislation, which seeks to codify rights and limit authority. Essentially, laws determine what is allowed and who gets to decide. Constitution. At a higher level, constitutional principles are used to protect liberty and read precedent. In practice, courts rely on earlier rulings to guide new ones. Review. This is where judicial review comes in, as courts review laws and strike provisions that don't hold up. In other words, they act as a filter for what stays valid. Criminalization. In some systems, laws are used to ban abortions and deter providers. Put simply, making something illegal is meant to stop it from happening. Sanctions. To reinforce this, authorities apply penalties and enforce rules. That usually means fines or other consequences if rules are broken. Medicine. Beyond the legal side, the medical field works to assess viability and prioritize safety. In essence, the priority is always the patient's well-being. Counseling. Before any decision is made, guidance helps to explain options and address concerns. This supports people in understanding their choices. Consent. From there, informed agreement requires doctors to explain risks and confirm understanding. In short, nothing proceeds without clarity and approval. Procedures. Different methods are then used to end pregnancy and reduce complications. The goal is always to minimize risk. Medication. In some cases, doctors use medication to induce expulsion and avoid surgery. Simply put, pills can replace more invasive approaches. Ethics. Alongside medicine and law, ethical questions require us to weigh principles and face dilemmas. There are rarely simple answers here. Autonomy. One key idea is the right to defend choice and assert control over one's own body. This centers on individual freedom. Agency. That freedom depends on the ability to use judgment and keep control. In other words, people decide for themselves. Status. At the same time, debates arise as people assign value and define personhood. This question shapes many moral arguments. Personhood. From there, discussions turn to whether we should grant rights or challenge definitions. This remains one of the most contested points. Society. All of this works to shape communities and affect inequality. Policies can influence how people live together. Health. From a public perspective, experts track trends and reduce harm. The focus is on making systems safer overall. Mortality. This includes efforts to count deaths and show disparities. Data helps highlight where risks are higher. Economics. Financial factors can worsen hardship and limit mobility. Economic pressure can shape long-term outcomes. Strain. Over time, these pressures can extend disadvantage and increase dependency. In simple terms, the effects can carry across generations. Thanks for watching. Please like and subscribe for more English lessons.